Okay, guys, this is going to be your airway management lecture. Again, I'm not going to be covering every single slide in this lecture. I'm just going to kind of hit the important ones to help you guys with your studies. The big thing I want you guys to remember is that this is a huge component of what we do in EMS. This is our bread and butter, is actually being able to protect the airway. I told you guys this before. We are airway ninjas. We do a lot of airway training. Specifically, once you guys get up to intermediate and paramedic, not much is going to change except for a couple of different tools that you guys will use once you move up there. The EMT basic here for the state of New Mexico, due to the fact that we are so rural, really gives you guys a lot of play in order to protect somebody's airway. And we'll kind of get into that as we go through this lecture. Okay, starting with the FIC principles: ventilation, respiration, circulation, and perfusion. We've already talked a little bit about ventilation and respiration. We're going to add the other two specifically for this lecture, and then we'll talk about it a little bit more when we get into cardiac emergencies. So ventilation, once again, is the mechanical movement of air in and out of the lungs, okay? We need to be able to get that oxygen in the lungs. We need to be able to take that nice deep breath in. We need to be able to have all of our muscles working, such as the diaphragm and our intercostals, in order to help expand our chest so our lungs can inflate. Remember that inhalation is an active process, so it does take energy for us to be able to take that inhaled breath. When we exhale, our diaphragm relaxes, right? So it kind of helps push the air out of our lungs. It is a passive process with this, so that way it doesn't really take a whole lot of energy, if any energy at all. When we're talking about respiration, remember respiration is just adequate gas exchange at the alveoli level. We take that nice deep breath in, that oxygen molecule goes all the way through our upper and lower airways. It goes all the way down into our alveoli, where those alveoli are surrounded by capillaries. The oxygen is onloaded into our system, and then CO2 is offloaded so that we can breathe out. That is due to pressure gradients in our lungs and diffusion, the actual scientific process of diffusion, from where gases travel from areas of higher concentration to areas of lower concentration. When we breathe in, the oxygen levels are higher concentration to our lungs compared to our circulatory system. So that's how we get the oxygen into our actual circulatory system in order to perfuse all of our organs and cells throughout our body. Circulation, we need to get those oxygen molecules circulated all throughout our body. So we need to have a good strong pump, also known as the heart. And then we need to be able to get the oxygen into the cells in order for them to be able to process energy, which is the process of perfusion. Remember, we do have to have an adequate amount of pressure as well for perfusion. Perfusion is just gas exchange at the cellular level, going all the way down to our big toe and unloading the oxygen into the cell and offloading whatever waste that the cell is producing for us to either breathe out or through our renal system and to pee it out. Okay, so when we're talking about the actual physiology of breathing, I know I jumped ahead a couple of slides, but you guys have already gone over most of the anatomy and physiology for the respiratory system, so make sure that you guys look at that PowerPoint again so that you guys can review that for yourselves. The respiratory and the cardiovascular system have to work together, and this is something that is kind of going to be a little bit confusing to you guys when we actually get into respiratory and cardiac emergencies, kind of differentiating between is this a respiratory problem or is this actually a cardiovascular problem? And we're going to talk about that more when we get into the respiratory and cardiac emergency sections of our lectures. But really, these two systems are working together to ensure a constant supply of oxygen and nutrients are delivered to the cells. If we're not able to get oxygen and nutrients to our cells start to die, and our cells do have some intracellular fluids, such as potassium, that can really do some harm to our body if those cells actually die off and kind of spill those nasty intracellular fluids into our circulatory system. And again, really, when we're talking about the physiology of breathing, Normal people are breathing in order to blow off CO2, right? We don't breathe to get oxygen. If we are normal, healthy adults, we are breathing in order to blow off CO2. We're going to talk about disease processes where that's not the case. The next slide here is actually straight out of your textbook. I would make sure that you guys understand the meanings of these. Make sure you guys know these definitions for the state test or for the national test and for the final exam. All right, ventilation, physical act of moving air in and out of our lungs. Again, inhalation is an active process. Okay, it is the part of the process that we use our muscles to breathe, so it does require energy. And this is using the diaphragm muscles and the intercostal muscles in a kind of normal, healthy adult. People that are short of breath could also be using their neck muscles, or what we call retractions, where their neck muscles are really kind of defined when they're breathing. You can see them kind of sucking in their intercostal muscles. You can actually see the rib cage as they're trying to breathe in and out. And then if it's really bad, they can be going down using their abdominal muscles if they're really short of breath. And this all comes down to as signs and symptoms for somebody that's really going into respiratory failure. We really just want to see kind of good, simple chest rise, bilateral chest rise, right? We want to see that nice, smooth, gentle chest rise in our patients. Once we start throwing in the intercostals, we can start seeing the intercostals kind of sucking in. We're starting to see neck muscle use. We could start seeing head bobbing, right, where people are starting to try to really getting tired of breathing. They're using too much energy. And when people get tired of breathing, that's a very bad sign, guys. That is a medical emergency. We need to help them out, and we're going to talk about that more as we move in through this lecture. Also, during the process of inhalation, we need to make sure that we have a good partial pressure. It means that we have everything kind of intact. There's no holes, such as like a gunshot wound or possibly some kind of penetrating trauma to the chest. That's going to make that pressure unequal. We do want that good partial pressure in order to get the actual air dissolved in the blood in order for us to circulate that through our system and perfuse the rest of our cells. Okay, the oxygen and carbon dioxide through the process of diffusion. Remember, diffusion is from higher concentrations to lower concentrations. They will keep diffusing in the lungs until the pressure is actually equalized, until there is the same amount of oxygen in the bloodstream with the carbon dioxide in order for us to blow that out. Okay, when we're talking about exhalation again, it really doesn't require much muscular effort, so it doesn't really require much energy in order to blow out. We kind of let gravity help us out during the process of exhalation. Once that kind of diaphragm actually relaxes and it kind of folds back up along the actual posterior section of the rib cage, it is blowing out the air. It's actually squeezing the lungs a little bit out for us in order for us to get all that nasty CO2 out of our lungs. Again, this is a passive process because of that, right? Because it's not really using the energy that inhalation does, okay? And this is where the when we actually get our chest to go back down to its quote-unquote normal position, this is where the actual pressure gradients start to occur or kind of reset in order for us to take that nice deep breath in again. Ventilation does require chemoreceptors and feedback loops throughout the body. Your main chemoreceptor, if you guys remember from your human anatomy lecture, is actually in your brain. It's actually the pons that does that for us. It kind of regulates how much CO2 and the acidity levels. Really, it regulates our acid-base balance throughout our whole body, and that's all regulating our how big a deep a breath we're actually taking in and what our respiratory rate is based on the readings that it's getting on the carbon dioxide levels in our body. Again, people we are going to talk about disease processes such as COPD that have a difficult time actually eliminating the CO2 because they have done damage to their body through years of toxic exposure, such as smoking or secondhand smoke. Okay, and remember, those people are actually breathing to get oxygen. They are no longer breathing like we do to eliminate the CO2. They are breathing in order to get oxygen.